thank the Honourable Member for securing this important debate. And I imagine there is not even a single member in this House who would diminish the importance or severity of this issue. We all want to see every child get the best possible start in life. But this is an empty commitment if we do not make sure the right level of support and help is available for children who suffer from mental health conditions. Just as we would for children with physical injuries, we would never allow a child with a broken leg to suffer alone, without professional treatment, nor should we fail to provide a child suffering with depression or anxiety with the support they urgently need. In the past, this issue has not been given the priority it clearly deserves, so I'm glad that finally a consensus is starting to build around the importance of improving mental health services for children and young people. But despite the acknowledgement that so much needs to be done, the government has failed to act decisively on this issue. Identifying a problem is all well and good. What we need is real leadership, concrete solutions and properly funded services. At present, they are failing on all three fronts. Not enough has been done to address the inadequacy of funding for services, or to reduce the number of children who don't have access to mental health support at all. The government's Children's Services Early Intervention Grant has been reduced by almost £600 million since 2013. It is projected to decrease by another £100 million by 2020. So children's services are now facing a funding gap of £3 billion by 2025. This underfunding is taking place in the context of a rising demand for children's mental health services. Underfunding leads to a vicious cycle, as the support necessary for good mental health through services like housing, education, and family support is gradually cut away. When these resources are unavailable, early intervention becomes impossible and mental health problems are left to fester and deteriorate, finally requiring urgent medical intervention. Children are not suffering from more mental health problems at random. The conditions for mental ill health are being created by austerity. That is why I support the recommendations of the LGA's Councils Can paper, which calls for the empowerment of local government to lead their communities and improve young people's mental health and well-being. And my honourable friend just mentioned about great point about signposting pathways and also helping the charities, which is very, very important. Properly funded housing, education and family support services need to be given priority to ensure the well-being of children and young people. Councils are uniquely placed to do this. That is why they need to be properly funded and at the heart of our efforts to address this issue. Inequality is also a huge issue in the delivery of mental health services for children and young people. Research this year from the mental health charity Mind found that the vulnerable people in some regions struggle with little more than half the NHS funding of those in the best resourced areas. To give one example, in Surrey Heartlands, the average annual spend on mental health services per head of population is just under £125. But in South Yorkshire and Bestlaw, that figure is over 220. So I must say that the government needs to act as soon as possible. That crisis is absolutely huge.